Welcome, everyone. I'm Beth Stewart, and on behalf of the Texas Oral Health Coalition, I'd like to thank you for joining us for the second webinar in a specially designed health communications e-learning series funded by the Delta Dental Community Care Foundation Oral Health Education Fund. All attendees have been entered into mute mode. Please enter any questions you have during the presentation in the chat box located on your bottom right. If you would like to receive dental continuing education credit, detailed instructions will be given at the end of this presentation. Please be prepared to write down the course code, copy-paste the URL from the chat box, or take a picture of the QR code with your phone. This learning series is a product of the Texas Fluoridation Campaign, a collaborative partnership between the Texas Oral Health Coalition, the Texas Health Institute, and the University of Texas Center for Health Communication in an effort to provide detailed information on how to create successful health messages to improve health outcomes. One of the coalition's grant deliverables is to provide spokesperson training for grassroots engagement. And as such, we are pleased to share today's presentation, Using Storytelling to Educate and Engage. Health professionals and advocates will learn how to use stories in their talks and presentations to illustrate the impact of poor health outcomes, deepen the public's understanding, and inspire advocacy. If you want to learn more about any of the presentations in this learning series, please visit the education page on the TechSOC website at www.techsoc.org. Our presenter today is Matt Jacob, who many of you may know or have worked with over the years. Matt's efforts in communications have been recognized or honored by a variety of organizations, including the Association of State and Territorial Dental Directors, National Public Health Information Coalition, the HealthLiteracyMonth.org, and the New York Times. He graduated with a bachelor's degree in journalism from the University of Arkansas in 1985 and previously managed communications and marketing activities for the Pew Children's Dental Campaign and the Children's Dental Health Project. Matt is known for translating complex scientific content into messaging that is clear, concise, and compelling, and most importantly, comprehensible to policymakers or the lay public. For more than 20 years, Matt has helped nonprofits and advocacy organizations raise their profile of their issues, particularly in the areas of health and education. It is my pleasure to introduce to you Matt Jacob.
Thank you, Beth. I appreciate the introduction. If you can hear me all right, let me know. I want to make sure my audio levels are fine. I'm looking forward to this. Excellent. I want to welcome everybody, and I want to start by my disclosure, letting you know that I have no financial or familial relationships to any of the agencies or products or brands that are referred to in this presentation. It's a pleasure to be here and to be talking with you about a topic that has become a growing interest of mine, and that is storytelling and the power that it has to help us advance important issues like public health. I think the thing that it's always important to reflect on is that long before human beings were writing their history, they were actually telling and listening to stories. We seem to be hardwired to want to tell stories, share information through stories, and to listen to others share their stories. And I think that's something that we can leverage as public health and oral health advocates in our work day to day, week to week. And let's talk a little more about how to do that. I'm going to offer you some tips, some ideas and strategies that hopefully will equip you with that ability. But before we get into the suggestions and recommendations, let's step back and hopefully reach agreement on why we want to engage in storytelling. I think there are some simple reasons for that. stories do help to gain and hold an audience's attention. And I think, as we all know, if you don't get their attention first, if you can't maintain that, the rest of your information really isn't going to be all that impactful. The second point is that stories are well remembered. People are more likely to remember a story that they've heard than statistics or other forms of information. You know, I think about some of the stories that were read to me in a classroom when I was a very young boy, or by my parents, and just how I remember them. I haven't heard those stories or read those stories in many, many years, and yet I still remember them. And I think there are some reasons for this, and I'll get into that more in a moment. Stories engage people emotionally, and I think that is something that's very important too. People tend to get involved and take action and be supportive when they've been touched emotionally. And that's one reason why stories can inspire people to act. It can inspire people to step out and do something that not only helps their own health, but helps their community's health. If they've already got a commitment to do that, storytelling can help to reinforce that commitment. You know, I think there is a tendency sometimes you'll hear people say, well, stories are kind of, you know, that's kind of a feel-good thing that people do, and it's not really connected to the evidence base, and we should be about the evidence. But it's important to recognize that many leading experts who very much believe in evidence have identified the importance and the value of storytelling as a way to complement the population-based data or evidence. In the Journal of the American Medical Association, in this article years ago, did just that. So, you know, I think it's important to think of stories as a way to complement evidence. It certainly doesn't replace it, but it can complement the evidence and make more people interested in that evidence. Stories offer validation, and I think one of the things that I've been noticing in recent years is how many hospitals and health systems are including patient stories on their websites. So they're really looking to connect with the public, and they're looking to do so not by, you know, them saying, hey, we're a great hospital, or we've got, you know, great physicians and great staffs, but telling that through patients' words and through the face of their patients, you know, providing a real world story. And this was one about a woman who was diagnosed with sickle cell disease. She needed a transplant, and really, you know, involving, they clearly interviewed her, they have quotations from her, and so they're really sharing a story about a patient as a way of demonstrating that they're a caring institution, that they're a successful institution. And so this is just one more way in which we see the benefits of stories. And if you don't believe that stories can inspire people to action, well, let me just share a few examples of where we've actually seen that. Ryan White, I think many of you may recall, maybe I'm dating myself here, but back in the early to mid 80s, as the HIV crisis was still fairly new, he was an Indiana boy who really got a lot of attention in the media because he was hemophiliac, and he contracted HIV from a blood transfusion that happened in a hospital. When it became known publicly that he had HIV, his middle school refused to let him come back to class. At that time, unfortunately, there was a lot of fear, a lot of panic about who could get HIV and how transmissible it was. Some rumors and fears that were not backed up by science. And after his death in 1990, sadly, if there was a silver lining, it was that he moved the nation so much that Congress, in a very bipartisan action, honored him by approving the Ryan White Care Act. That act was aimed at addressing gaps in insurance. So people who were uninsured or underinsured were able to get coverage to help address their HIV status. This is a more recent example. Lily Ledbetter, some of you, the name may be familiar. She was a supervisor at a tire company plant in the state of Alabama. And she learned one day by accident that she was being paid a much lower wage than men who were doing the exact same job. And she tried to seek action internally for this. And her story really spawned a national effort to promote equal pay for equal work. And because of some technicalities in existing federal law, she was not able to get the kind of legal decision that would allow her to get back pay for that gap in pay. And so Congress in 2009 passed the Lilly Ledbetter Fair Pay Act. That 2009 law makes it easier for women to sue when they've discovered this, that you don't run into a situation of, well, you had to report it at the time. This law takes into account that you can't always know right then and there, and it does give women a little more opportunity to seek legal redress. This is something that is a story, very sad one, that does have some silver lining, as sad as it was, but this is something I think near and dear to all of us who work in the oral health field, and that is the story of Diamante Driver. Here was a 12-year-old who lived only a few miles away from the White House and the U.S. Capitol, and his family was, his mother had enrolled him and Diamante's brother on Medicaid, but she was having a hard time finding a Medicaid participating provider. There were other crises going on in their lives because of a housing issue. His other brother was quite sick. So a lot was going on, but as this story indicates, there were some major changes made in Maryland's Medicaid program. And Maryland is in many ways recognized as a state that has really taken the kinds of actions that other states, have been advised to take, and has really helped to close much of the gap that exists. Still some real issues there, but it did spawn action and improvements, and I think rightly so. So, stories, putting a face on an issue is just so important these days because there's so much out there. There's so much noise on mainstream media, social media, and so on. And so, trying to get people to pay attention, helping them understand what's at stake can be assisted with stories. Stories create context. And this is a good example. There was an issue a few years ago in Rutland, Vermont, a city in central to southern Vermont. And Rutland was being asked to consider whether they should continue water fluoridation. Michael Dick is a dentist in Rutland, and he had practiced for 40 plus years. So he'd been there a long time, even before the time they fluoridated. And he wrote an article that was published in the local newspaper soon before the community voted. And he told this very brief story. When I practiced 41 years ago, the tooth decay was unmanageable. My reception room played loud music to muffle the sound of children crying as their teeth were drilled, filled, re-drilled, and refilled. It's a very brief story, certainly, but it still, I think, has a lot of power to it. There's a kind of a saying, we can disagree with what someone may believe, but we can't disagree with what someone has experienced, what they've actually seen or done. And so I think, stories like this can be very, very powerful. The community, several days later, voted by a comfortable margin to continue community water fluoridation. You were asked as registrants for this session to take a look at a video, the link that I had sent, and this was a TED Talk by an educator. Her name is Rita Pearson. And what I would like to do is I'd like to get any comments or feedback people might have about what they heard. I think Rita Pearson's talk demonstrates how you can use stories in a talk, in a presentation, as a way to help amplify key points, provide important context for what it is that you're talking about, why it's important. And I would love to get any comments that any of you may have who watched that video. It was a little less than 8 minutes. I'd love to hear from you as to there's a chat box if you want to post any comments, any impressions you had, what you found that stood out, what you liked about it. If there are any thoughts that you have, I would love to hear from you. Beth, if you could share any of those comments, I would love to kind of speak to them or share them.
Okay, thank you, Matt. I'll wait for some of our attendees to write something in the chat box, but I will share that I watched the video myself and loved it actually. She was a former teacher, but I loved her stories, the way she really brought those stories into what the discussion was about. It really enhanced, I thought, her talk overall, and it made you remember, what she was talking about. And I don't know, I found it really engaging. I enjoyed it immensely. Let's take a look and see if anyone else. Go ahead. Oh, there we are. Let's see, Deborah wrote, she was able to draw us in and to create a sense of reality and urgency. Dr. Kennel wrote, stories allow you to participate in the personal experience of the presenter. I could envision myself being there with Rita and having the same experience with her. I agree.
Yeah, that's a great comment. Yeah, one of the things Rita said early in her talk, at one point, she tells the story, I think you all may remember if you had a chance to see it, that she was kind of talking with a teacher in the teacher's lounge who told her, well, they pay me to teach, but they don't pay me to like the kids. And her response was, well, I got to tell you, kids don't learn from people they don't like. And I thought that statement was, coming out of that story, which was very brief, right? It wasn't a long story. It was just a good way of helping. If I'm in that audience, I immediately know, what Rita Pierson's values are, how important that is to her, that she doesn't just believe you go through the motions and you teach a lesson and then you get in your car and you drive home, that, you really, you feel connected to these kids and you want them to succeed. And so I just thought it really, the theme of Every Child Needs a Champion, that story really folded right into that. Were there any other comments that people had, Beth, that you might want to mention?
I'm not seeing any right now, Matt.
Okay. Okay. The other thing that I thought was really interesting was her story about mathematics lesson. She said, I taught this the wrong way, and I found out only after I had taught the lesson. And you remember she said, have you ever thought of apologizing? I mean, it was an interesting, provocative question of the educators in her audience. Have you ever thought of apologizing? Students don't expect you to, but this does make you more human. And she talked about how she taught the lesson wrong and come back and told the class that, and they said, oh, well, Miss Pearson, you were so into it, we just kind of let you go. And it really prompted a lot of laughter in the audience. But it's a good reminder that stories don't have to be super serious. Having a sense of humor can be a nice way to add levity to a talk and still kind of connect with your overarching message. And I think that's the key here, right, is that telling a story helps others understand what makes you tick, sharing your values, what motivates your work. And that's, people want to know that. If I'm sitting in an audience, and even if there's a guest speaker coming up and I don't know you, I'm trying to get a sense very early on about who you are, what your values are, what kind of brought you here, why you work in this field. And Rita tells stories that help us very quickly discern why she does the work she does and why she's so committed. It makes you more relatable, it builds trust. It also humanizes you, and it makes it easier for others to view you as someone who cares about their health, about their success, what have you. And there's the saying, I think most of you probably heard, before they care what you know, they must know that you care. And I think this is really fundamentally what's going on here, is that you want people to see you as a sympathetic person, as someone who's relatable, as someone who they find themselves thinking, okay, this is a likable person, it's a trustworthy person, and that's just going to make whatever else you say that much more impactful. So why do stories make an impact? I think, Beth, one of the comments that you read from a dentist or physician, I think said it well, right? That physician said, I could almost feel like I was there. I was kind of watching this. And I think that's at the key of it all. Steve Schenken is a best-selling author. Some of you may be familiar with his books that I think it's historical fiction mostly for young adults. But he was asked, why stories are so impactful. And this is what he said when he was interviewed. I love this last sentence: because the listener has engaged with your message by creating mental pictures that complete your story. So as you're telling your story, we are imagining it, we're visualizing it. And we know that we tend to remember visuals, very well. If we just hear somebody over the phone saying something without any visuals, it's a very different thing. But when you have visuals to kind of complement and complete a story or explanation, it really makes a difference in terms of memorizing. So there are lots of stories being told, and we certainly, if we're going to do this, we want to make sure we're telling good stories. We're telling stories that are going to have an impact. They are going to resonate. They're not a bland story. What separates the two of these? Let's walk through that. So I think there are 6 key qualities of a good story. And the first is it is personal. It's something that you experienced or observed, and no one can really dispute that, right? And I think that was what was so meaningful for Rita Pearson's talk, was that the stories she shared were her own experiences. She told a story late in her talk, you all may remember, about her mother, who was an educator, and how people came back years later when she passed away, and how, while it was sad, she really took so much out of the fact that all of these young adults had come back and had remembered the impact her mother had had as a teacher, of keeping, peanut butter crackers in the desk just for kids who maybe didn't have much to eat that day or the day before, keeping a bar of soap for kids who maybe weren't washing regularly, just really thinking about their total health and well-being and character. I think the second quality, again, is one I mentioned earlier. It connects with our emotional being, right? It's sort of, I think it's important to realize we want to talk to their head and their heart. And data and other information is certainly going to help talk to their head, but we want to talk to their heart too. We really want to connect on that kind of level. A good story has a character who is relatable or likable. And it doesn't have to be both. Sometimes it is, but it should be one of those. And I think what was true was in the stories that Rita told, I think you saw that. And then number 4, the tension, right? It has a tension that grabs and keeps our attention. So the story that she told about the teacher who said, well, they don't pay me to like the students. They pay me to teach a lesson, and I teach it, and then I go home. You could almost sense, that meeting room or that teacher's lounge, and you're hearing a teacher say that, and Rita is hearing that thinking, oh my goodness, so there's this kind of underlying tension that, because she's going to respond to that and say, sorry, I disagree with you about that approach. You also want a story ideally that is not predictable. You want there to be at least a few twists or turns that not everybody listening to it is going to be able to expect, right? I think that kind of helps build some suspense. And then last but not least, you want stories that are focused. And that means not having a lot of extraneous detail. You could tell them what you were wearing that day. Is that really important? No, I don't think it generally is going to be important. So, I think this is one reason why you want to develop a story, you have a story, you want to kind of reflect on it and decide, does it have additional detail? Does it have too much in there? Are there ways I can kind of hone this and shorten it? A good story has a structure. It is not unlike a movie, and it makes sense, right? Because movies are almost always a story. They introduce characters. They have a degree of tension between those characters. That tension is eventually resolved. But this is really, this comes from Pixar. Pixar's basic theory, there's 6 rules of great storytelling. And this is sort of a structure that just one representation of how a story flows. And, you introduce these characters. I was doing this. My spouse was doing this. My child was here. Then one day he saw, we saw, I heard, right? And then the story kind of develops from there. And so this is kind of the best way to think about how a story is going to flow. So this is a question perhaps some of you have been thinking about as this webinar's gone on. Do I have a story that's really worth telling? And I want to tell you that I truly believe that every single human being has at least one story worth telling, probably more. But I think some people are a little severe on themselves. I can't think of anything to tell. Somebody else told a great story, but I don't have a story like that. Most people do have, a really interesting story that they may not be giving enough credit to. They may have overlooked or may have forgotten about. And so let's kind of explore this. How do you try and discover or find your story? What kind of story would work best as you reflect on this? So I think a lesson or value that can be shared through a story is really important. And as I mentioned, I think Rita Pierson, the educator, really pretty early in that talk conveyed her value that, kids should feel like their teachers like them, that they care about them. There's that sense of empathy. When she said kids don't learn from people they don't like, that was just a powerful statement. I immediately knew when I heard that, okay, wow, this is how she thinks. This is what motivates her. This is what drives her as an educator. So that lesson, that value, and I think many in our audience who feel the same way immediately felt like, I kind of know you in this way that I didn't 10 minutes ago. And so you want a lesson or value that is likely to connect you closer to your audience and kind of break that distance that may exist when you first walked into the room. So the story can really reinforce a variety of lessons. I mentioned the lesson that I think that Rita Pierson was trying to convey, which is, hey, children need to feel that their teacher likes them, wants them to succeed, if they're going to learn, that is important. But a story can reinforce a variety of lessons or values, whether it's, success is achieved by working together in collaboration. Situation can look hopeless, but it really never is. Overlooking small details, can create big problems. Many stories can be connected to a whole lot of lessons and values. So just keep that in mind. I think the second thing to be mindful of is that a story can actually benefit your efforts as a public health advocate or public health professional, but it doesn't necessarily have to be about public health. There are various lessons that you can point to that can really kind of stories that can circle back and help you connect dots that have implications for public health. But again, the story doesn't have to be about public health. And I think, something that's very important is you don't want to be the hero of your own story, right? So sometimes people will think, oh, I've got a great story, I did this great thing, or, I graduated, I got my master's degree and then I did this. And, that can come across the wrong way, even though it's not intended to. Some people hearing that kind of a story might think, well, this person's a little too into themselves. So you really, you kind of want to veer in the opposite direction, a story that humanizes you and makes them see you as somebody who, yes, has some good qualities, but has some faults or foibles. I think Rita Pierson did a great job with that by owning up to the fact that she had taught a lesson wrong one day and she didn't realize it until the next day, and she had to come back and tell the class that. So that was a self-deprecating story, but I think it humanized her in a way that made her more relatable. So that is one reason why you want to avoid being the hero of your own story. And your story can be serious or it can be humorous. And I think, again, the TED Talk that I shared hopefully demonstrates that. There were some very poignant stories in there, but there were also one or two humorous stories that I think, you know, was a nice balance. I think sometimes if you have multiple stories, having one that's more serious and one that has a little dose of humor is very helpful, especially in stressful times like these. This is one of the hardest things, I think, when people are sharing a story. And it is what makes people really feel like they were there, right? Which is not just to say exactly what you were saying or doing or thinking, but what were you feeling when this happened to you? You know, that's when people really get a sense of what makes you tick, of who you are, what values motivate you, you know, what are your goals? Those are important things, I think, for people around you to understand. And I think making sure that that feeling piece is in your story is an important thing. So finding and delivering your story, this is a very important part. I want to first, I've talked about the kinds of elements that should be in a story, ideally. Let's talk about finding your story, then we'll get to the delivering part. So how to find your story? Well, you know, I think one of the things that's important is to consider whether you've learned valuable lessons. We all do, right, throughout life. And so just thinking about in recent years, has something happened to you that really was a bit of a game changer, really made you step back and reflect on your life, on your career, on your goals professionally, on your family? Think about, you know, something like this. It could be health related, it could be not health related, but this can be the kind of question that might help you get to a point where you're like, hey, you know, this is something I could share in some form. Did you meet someone and later find out that you had made assumptions about them that might be way off track? You know, did someone or something really surprise you in some ways? This can be a useful way to connect in a variety of ways that helps you challenge assumptions that people make, right? If you can share a story that shows that you made some assumptions that turned out not to be quite accurate, that might be a valuable story. And there are very specific health-related questions that can also help you find your story. This is one of them. You know, a lot of people like me remember, if you grew up in the 70s and the 80s, you saw a lot of TV commercials about dentures. We don't see those much anymore. They're much rarer than they used to be. And but it was a reflection of a different time. It was a reflection of a time when, you know, our parents or grandparents grew up without the benefits of fluoride and without maybe seeing a dentist, going to get dental care on a regular basis. There were a lot of things going on. And that can be an opportunity to talk about oral health by sharing, you know, your memories of maybe having a grandparent or parent who had lost their teeth, all or most of their teeth, and what it meant to them, and the frustration or the impact. This is a related question. You know, many of us have had friends or classmates or neighbors who had poor oral health. Maybe we didn't pick up on it right away, but we noticed they were self-conscious, they seemed a little bit withdrawn, they were hesitant to maybe smile and allow people to see, you know, the condition of their teeth. This is, I think, a powerful way just to indicate how oral health has, you know, an impact well beyond, you know, the oral cavity, your overall self-satisfaction, your quality of life, your self-confidence, so much of what we value that makes us feel secure in our world and, you know, among our friends and family come into play. So think about that. That could be a theme as well. And then, you know, let's not overlook this, right? In the past week or two, I'm willing to bet that every one of you has told a story, at least one, probably two or three or four. Right? So think about the stories that you already tend to tell from time to time. what implications do those stories have? How could you draw a connection between a lesson or kind of the theme of that story to what you're trying to do in your community or in your state to improve public health or oral health? So don't overlook that. And then I'll give you a very personal example. Sometimes if you can't think of a specific experience and tell that story, one approach is to allude to a story without necessarily telling it in full detail. Let me be a little more specific here. So I was pleased recently to receive an honor from an oral health organization, and I was asked to give them some remarks, to make a brief a set of remarks. And as I was thinking about this, the thing that came to mind for me was a movie I'd watched, and of course movies are stories. The movie Hidden Figures, and many of you may have seen it. It was nominated for several Academy Awards. It was a 2016 movie, and it was about the African-American women who had played critical roles in the success of NASA's Project Mercury space flight, which happened in 1962, the one that John Glenn, the astronaut, was on. And the reason it made such an impact on me is it was just kind of a reminder that so often success for an organization, for an administration, for a project is much more than the people who might get the attention, who might appear on TV, whose name is in the newspaper, right? There are people behind the scenes that are playing really important roles. And I think when I reflect on that, it's a reminder to me that there are so many people that I work with in oral health who, don't get a lot of attention, or don't get a lot of praise. They quietly, diligently go about their work and make a real impact. And so I kind of talked about that movie as a story that had this meaning to me, that I wanted to applaud, the people out there who are working, not getting a lot of credit. Their story isn't always known, but are doing important work that's helping to improve oral health. So sometimes just pointing to a different story, pointing to a book or a motion picture or something like that, a story that many people in your audience probably know at least some about. They may have read it, they may have watched it. That can also be another option for finding your story. Delivering your story. This is something that people don't always think as much about. You may have a really great story, but are you telling that story in a way that really, really maximizes the impact? I think that's something that that is really important. So, you want to make sure you're telling it in a way that maintains and builds suspense. You don't want to sort of give away the ending or the resolution. And then you want to tell it with passion. And that means, your pacing and your inflection. You stop. You may pause for just a long, long second before you continue, right? It's really, and this is something that gets better with practice. And if you have a presentation to make or a speech to give, and you want to use a story or two in it, it can be really helpful to get tips or get feedback from somebody about how well you told your story and how impactful it is, because we all get better. Practice makes perfect. And like I said, you want to adjust the pace, the inflection or volume of your delivery. I encourage you to go back and watch that TED Talk with Rita Pierson again, because what you'll see is one of the things she's very effective at doing is the pitch, the inflection, how quickly she delivers her remarks. She alters her pace 2 or 3 times, to emphasize a point or just to let a point kind of hang out there, right, before she moves on. The pacing, the pauses, that kind of helps people transition and understand, when your story's building and coming to a resolution. So practice is important, and finding a friend, a partner, a spouse, someone who can give you honest feedback, right? You don't just want someone who's going to go, oh, that sounds great. It's a wonderful story. Yeah, that sounds good. Don't change a thing, right? They may be telling the truth, but often it can be tough to get people who will really give you honest feedback. And so, finding somebody you trust who you think will really tell you what they liked and what they would maybe change. And some of the key questions here are, what details, what might they have wanted to hear more about that were missing, as well as what details in the story did they feel were just not worth including. They didn't need those details that you could get rid of, and kind of hone your story. And then revising that story based on their feedback, constantly honing it, adjusting it, revising it. I think another thing that is important is to make sure that the language in your story is aligned with the audience's culture and knowledge. And this is something that, is just very important. I don't know that I have 2 or 3 great examples to give you, but audiences differ significantly one from the next. So if you're talking to oral health colleagues, they're going to have a culture and a knowledge base that is going to be quite different than if you're talking maybe to a group of parents, or if you're talking to a group of school board members about the importance of oral health programs in schools. Really take into account, okay, what do I know about my audience too? Because the way I tell my story and the terms I use are probably going to need to be tweaked to reflect their knowledge base. So I don't want to use a clinical term or an acronym that has them going, what does that mean, right? Whereas with some audiences, some oral health audiences might totally understand what you mean when you refer to HRSA, but many people are not going to know what that means, what that stands for. So just really important for you to step back and make sure that your language is aligned. I think that stories get better. Stories, once you've told them once, you tell them a second time, a third time, every time it gets a little better. You become more confident. You understand what works. And I think you also, when you have an opportunity to talk to different audiences, you understand what point of the story you might want to pause a little more for, or change your tone or inflection. And so I think that's one of the key things as well. I would love to hear from more of you after this webinar, as well as right now. I want to open it up for questions and comments, but I want, Beth and the Texas Oral Health Coalition team to know that, if somebody does have a question or just wants to get my thought on a particular type of story, please feel free to reach out to me. If I'm a little crunched for time, I might not be able to respond in 24 hours, but I'm certainly willing to talk more with people about storytelling. I just think this has so much potential to really complement the important messages we already have. And I think if we start incorporating it more in the talks and in the engagement that we do, I think we're going to be much more effective in our work. So, I just want to really instill that. Are there any questions or comments, Beth, that I can answer?
Yes, Matt. Beverly asked, can you give some examples of stories that oral health coalitions might want to tell?
Wow. Well, I think, the difficulty with that is, remember, one of the qualities that I think is so important about effective storytelling is that it be personal, that you have something that happened to you, that you experienced, or that you witnessed, and even if it's a book or movie, it's that you read it. And so I think it's a little tricky to sort of look for the story that everybody can use or can tell. I think that, let me try and come close to that though. So I think that, and I can't take credit for this, a former colleague of mine actually came up with this. And I don't know that it's really a big story, but it kind of is a story. And here's what I'm talking about. Think about if you're speaking to an audience, maybe an audience that has above average educational levels, and you want to engage them and help them understand about the impact of oral health. What if you said to them, I want all of you, open your remarks by saying, the last time I was looking for a job, it was stressful, it was challenging. I was looking for opportunities. I wasn't sure, whether I'd get called back. And I want all of you in this audience to think about the last time you were looking for a new job and you were sending out resumes and you were hoping to get responses, and maybe you had an interview scheduled and you had to begin preparing for that interview and imagining the questions you might get asked and wanted to be prepared so you weren't caught off guard. And now, on top of all that, just imagine if you had to worry about one other thing, and that is having unhealthy or missing teeth and going into that interview and worrying, are they going to see the condition of my teeth? I think anything like that can really bring it home to people how an activity like job hunting that so many of us take for granted, how that becomes so much more stressful when you are someone who has been afflicted with poor oral health, and maybe you're missing teeth or the condition of your teeth is such that, people will notice and you're worried about that. You feel kind of on stage. So I don't know, Beth, if that's a direct answer. It's really a story, but I think it's the kind of thing that could be used by multiple oral health advocates. But I think the story really should be as individual and personal as possible.
That was a great example, Matt. And it really, you went back, because one of the questions that I had was, do the stories have to be about something that you experienced personally, or can it be about a friend or a colleague or family member that you're sharing? And those don't carry as much weight as something that you personally, because it's not as personal. Is that correct? Or is it okay?
Yeah, I think that's true. Now, well, I think it's a mix. I think those personal stories are more powerful, but if you're telling a story and the story is really sharing what your best friend or a close classmate told to you, you could turn it into a story by sharing your reaction to it, or how bad you felt for her, or the anxiety that you knew she was going through at that time. It could be sort of told in that way. Or the fact that you felt maybe helpless, that you couldn't solve that problem for her or for him. And so that might be some way to kind of translate that story. But I think the best stories really are those that have either happened to you or a member of your family or close friend, that you were present at, or something unfolded that you watched, you observed, you heard about in a more firsthand way.
Okay, thank you, Matt. That was an excellent explanation. Are there any other questions from any of the attendees, or would you like to share a short story or something that you were thinking about using?
And I think, Beth, again, the thing I want to reiterate is that people tell stories. We do that. And so sometimes people may think hard and think, oh gosh, what story could I tell? And a lot of times a story that they periodically do tell, we all do that, right? We all have maybe 2 or 3 or 4 stories that we seem to share because they are related to kind of larger issues, and they have that kind of relevance to them. And so, think about the stories you've told friends or neighbors or coworkers over the last 12 to 18 months. There's a decent chance that 1 or 2 of those stories could have a theme or some element to it that would allow you to kind of make a larger point about health and about wellness, or about people's ability to to improve their health when they lack the knowledge, right? The importance of being informed. So there are a lot of different ways, I think, to come at it.
Okay, let's see. I'm not seeing any questions or anyone that would like to share anything in the chat box. So, Matt, we want to thank you so much for this presentation today.